Hello, everyone. Welcome to Therapy Clips with Dr. O. Today, our topic will focus on depression and substance abuse. Just to give you a brief overview of depression, depression is a psychiatric disorder in which a person experiences a very low, depressed mood. At the same time, the person may also have changes in other areas, such as sleep and appetite. Depression differs from normal sadness or feeling blue in that it is severe enough to cause problems that interfere with day-to-day functioning. People with depression often have things like low concentration, lack of sleep or sleeping too much, also eating too little or eating too much. They may have some things like irritability, low concentration, maybe something else that they experience. So, depression is just more than being sad. We all become sad from time to time. So, that is normal to be sad from time to time. But when depression is severe and it interferes with day to day functioning, then that means that the person is depressed more often than not. So they have more days of depression than days of just feeling normal and being happy. And so these are the things that I want you to focus your attention on. Sometimes depression can be the result of not using substances that your body have become accustomed to, but it can also be because of using certain types of medication. So I want you to keep that in mind also. So as we go through the module, I'll point out more things that I want you to know that's related to depression and substance abuse. So now I'm getting ready to go into some more things that I'd like for you to understand. There are certain types of medications called antidepressants that's on the market for substance abuse. I'm sorry. Well, it can be used for substance abuse, but also for depression. So I want you to also know that people lose energy as a result of being depressed. Depression is a common psychiatric disorder. About 15 to 20% of people experience an episode of depression in their lifetime. Depression may occur at any point in a person's life. This depression can last for weeks, months, or even years. Some people may never fully recover from depression. So, here's your first question. What are the symptoms of depression? I'll answer the question. The symptoms of depression is depressed mood, diminished interest or pleasure, change in appetite or weight, change in sleep patterns, change in activity level, fatigue or loss of energy, feelings of worthlessness or inappropriate guilt, decreased concentration or ability to make decisions, recurrent thoughts of death. A diagnosis of depression means that you have at least 5 of these symptoms that have occurred in a 2-week period in order to be diagnosed with a depression. So the symptoms must last for at least 2 weeks. In children, we look at the symptoms being just 1 week. So there are biological theories And also they're called biochemical theories that suggest that there's a chemical imbalance in the brain, particularly the chemicals norepinephrine and serotonin. And these imbalances may be the cause of genetic factors or effects of the environment that keep a person depressed. Someone who suffers the loss of a significant person early in their life may have or be vulnerable to depression later in life. Depression is more likely to happen after someone has a major loss in his or her life, such as the death of a loved one, divorce, losing a job, or if they're under a great deal of stress. Question 2. Which of the 4 theories are biological? Which are environmental? When we think of biochemical, it's biological. Early loss in life is environmental. Major loss or stress is environmental. The lack of support is environmental. So what is the connection between depression and substance abuse? Using alcohol or drugs can cause a person to become depressed, while either they're high or intoxicated off of liquor, or even withdrawing from alcohol or drugs. It is common for people to become depressed when they're drinking. It is also common for people to become depressed if they're withdrawing from cocaine. Because of this, treatment professionals may decide that people who are going through withdrawal from alcohol or drugs need to be abstinent for at least a month to see if their depressive symptoms need additional treatment, or if the depression will disappear by itself. A good way to determine whether depression is caused by drugs or alcohol is to observe the person's mood when they're abstinent. If mood continues to improve in a certain period of time when the client is abstinent, then the depression is likely the result of the drugs or alcohol. But if a person is even more depressed, even after being abstinent, then the person is more likely to be clinically depressed. Another way that depression may interact with substance abuse is that people are more likely to use or relapse when they are experiencing negative feelings. And so, because of these negative feelings, being depressed may make more depression when the person is under the influence of alcohol or drugs. They may use alcohol or drugs to try to feel better. This is called self-medicating. The problem with this strategy is that even if alcohol or drugs make someone feel better for a little while, they almost always make the depression worse when they're not high anymore. Question 3 is based on this scenario. Bonnie has been feeling depressed for the past 2 months. She lost a job and connection because of not going to work, missing work, because she was so busy getting drunk or high. When she got a positive urine screen for cocaine at work, she was fired. After that, she had given up on trying to find another job. She began to drink more heavily and smoke more crack cocaine, which made her depression worse. She began lying around her apartment all day, sleeping, trying to watch TV, but she couldn't even concentrate long enough to watch the video. She kept on getting drunk, getting high, and decided to kill herself several times. After a month of going through this, she was left by her boyfriend. So, this made going to sleep at night more difficult. What are Bonnie's symptoms of depression? So, when you think about it, the symptoms of depression was couldn't sleep, couldn't concentrate, depressed mood, thoughts of suicide. Those are just a few. Lack of energy because she was laying around her apartment all the time. Using drugs or alcohol to feel better. So these are some of her symptoms of depression. Food for thought. What are some of your symptoms of depression, if any at all? If you are experiencing depression, any of the symptoms that I mentioned, please speak with your therapist about it. If you're in session with me, you can speak with me about it. At times when we talk in individual session, not in group, unless you want to. But if we're talking individually, that is your time to speak with me about your feelings of depression. And do know that if you are depressed, there is help. There may be medication you may need to ask your physician about. And then try these medications. But if you try an antidepressant, know that the symptoms are not going to be relieved right away. It takes at least a month for the medication to get through your bloodstream and to be effective. So hang in there. Don't stop taking the medication. If in fact you are treated for depression and you feel as though your medication is not working for you, that may be the reason. Okay. So we have different categories of antidepressant medication. These different categories are tricyclics, MAO inhibitors, selective serotonin reuptake inhibitors, serotonin and norepinephrine reuptake inhibitors. So, I'm just going to go through the tricyclics. Tofenil is one that you may have heard of. And the side effects are dry mouth, dizziness, sedation or agitation, weight gain, constipation, heart palpitations. Now I'm going to move into another category of medication. The MAO inhibitors. You may have heard of Nardil. Its side effects is insomnia, dizziness, weight gain, sexual difficulties, confusion, memory problems, overstimulation, hypertensive crises. The next category, selective serotonin reuptake inhibitors, are also called SSRIs. You may have heard of these medications: Paxil, Prozac, Zoloft. The side effect: nausea, vomiting, excitement, agitation, headache, sexual problems. The next category is serotonin and norepinephrine reuptake inhibitors, and these are called your SNRIs. One brand name that you may have heard of is Efflexor. Side effects are the same as the SSRI, except that it tends to elevate blood pressure. And then you have other compounds. Wellbutrin is a common one that you may have heard of. And its side effect is sedation and agitation. Now, besides the medication, there is psychotherapy that's available. Psychotherapy comes in the form of individual psychotherapy, counseling, or what we call talk therapy. And that's what I do. Dr. Paula, if you're in therapy with us and in treatment with us, then she does the medication therapy and I do the talk therapy. And so what this tends to do is help you, the talk therapy that is, or psychotherapy, help with dealing with certain situations such as social, relationship, or work problems. What I do is I work to change your negative thinking into more positive thinking. You can also engage in group and family therapy. A lot of what we do as far as depression is called cognitive behavioral therapy. And that's where we change in the negative thought processes into positive thoughts. There are other type of treatments that's available that's complementary. And we will suggest that you do these things like cardiovascular exercise. This includes running, swimming, walking, or riding a bike. Also, you can do things like strength training with weights and exercise machines. Such things as relaxation type of exercises include yoga, stretching, breathing, meditation. And that's just about it. So in summary, depression is a psychiatric disorder in which a person experiences a very low or depressed mood. It differs from everyday sadness or feeling blue. This type of disorder interferes with a person's day-to-day functioning. About 15 to 20% of people have experienced an episode of depression in their lifetime. Research suggests that there are environmental and biological causes and also chemical imbalances in the brain that can cause depression, especially if a person is under a great deal of stress and have a lack of social support. Using alcohol or drugs are risk factors for depression. Also, depression can also be a risk factor for substance abuse. And finally, once again, there are different types of treatments that's out there to help you. And this includes medication, psychotherapy, and and also complementary type of treatment. Sometimes I talk so fast, or if I'm tired, I get tongue-tied. So please excuse that. But anyway, moving along, using these treatments can be a protective factor against substance abuse and mental health problems. That's what I wanted to say. Have a blessed day. I'll speak to you if we're in individual therapy this evening. For those of you I have scheduled, I'd like to thank you and have a wonderful day ahead of you. And always love someone. Take care.